We have many patients, but in your case, I know how you have a previous liver disease, and I don't know if you may tell us about your story and why are you doing this?
Well, 22 years ago, I went into my physician. I was really jaundiced. So I went in and he sent me over for tests. Come to find out I needed my gallbladder removed. So I had my gallbladder removed, and a year later I turned yellow again and I got really sick. So I went in and started doing tests, and they could not figure out what was going on. Did ultrasounds, and a doctor had a liver biopsy done where they put a needle through my side, and it messed up my shoulder, and I had headaches. And so he put me on some medication that it really wasn't working, and had no idea what to do. Said that I was most likely going to be put on a transplant list. When I went in, he slowly took me off of all the prednisone and everything that he had me on, and put me on esophageal. And for 22 years, he's been having me go in every 3 to 6 months and have my blood work done. And he was having me do ultrasounds, and then it went to MRIs and a couple of liver biopsies. So this year, 5 years ago, I found out I had varicose veins in my esophagus, and of course my mother passed away of liver cancer, and she had varicose veins. So it was kind of scary for me. And this year I get very emotional, because this year I went in I think around March, and went in for my scope on my varicose veins, and Dr. Harmston told me they were gone. They had disappeared.
And then he told me that my liver functions were doing way better, and that they were getting better too. But during COVID, he told me that I might still have to have a transplant. So this year, finding out that I don't have to have one, that I'm doing way better, then I told him that my cousin had came here to this hospital and had surgery about 1.5 years ago. And she told me that it saved her life. She just kept telling me, it saved my life. You really should do it. So I talked to Dr. Harmston, and he told me he could help me with that, and that he felt that it would be the best thing for me. And so my supportive husband, our insurance wouldn't cover it in Utah, and we couldn't afford to do it in Utah. So I made the first move to start paperwork, and Dawn called me, she's a coordinator, called me and wanted to know all my information. I told her I was already filling it out, but in July, when my doctor told me that he would put in a referral and he suggested I do it, I started doing the bariatric diet, and since July 10th I've lost 22 pounds.
Congratulations.
But now I get to do it.
And today we're gonna do the gastric sleeve. Everything is perfect. We're gonna take good care of you. Thank you so much for trust your help in Mexico Bariatric Center. We're gonna do the best. I'm sure the surgery is gonna improve your life, your health, and you're gonna be able to live with your family. Okay.
My family is all rooting for me. They've even started buying me little cups and stuff for measuring and everything. So, yeah. But thank you so much.